It is my pleasure to introduce our speaker today, none other than the Vice President of Health Promotion, University Chief Wellness Officer, and Dean of College of Nursing here at Ohio State, Dr. Vern Melnick.
Thank you, Josh, and hi, everybody. I'm going to introduce you to somebody today who is by my side all the time. I'm going to give you some pug love today. This is Honeydew Mellon, and she has a brother, but he's more independent than Honeydew. She was born with a shunt from her liver to her inferior vena cava. And we didn't know that for about 3 months, but our fabulous vet school did major surgery on her. She's doing fantastic. Her growth is a little stunted from that original problem, but she is small, but very mighty. And I just read a study that actually people who watch videos of puppies actually can really improve their mood and decrease stress. So I wanted to start my talk by saying I'm a big pet advocate, and we have so much evidence to show that pets enhance both our mental health and our heart health. So why take really good care of our hearts? I don't know if you know these facts, but our heart beats at a rate of average about 80 beats a minute, 115,000 times a day, or 42 million times in a year. So during an average lifetime, our heart is going to beat more than 3 billion times. And that's why we've got to engage in heart healthy behaviors to prevent cardiac disease. Technically, cardiovascular disease is still our number one killer in the state of Ohio, as well as across the United States. 600,000 people in the United States die of heart disease every single year. Somebody has a heart attack every 34 seconds. 1 out of 3 men and women die of heart disease every year. Now, in terms of if you are a woman, women tend to delay much longer than men in seeking help, seeking treatment. One of the big reasons women tend to delay more is they sometimes do not have the classic symptoms of a heart attack that men have. You know, that heaviness of the chest, feeling like an elephant sitting on your chest, radiation to the left arm. Women often have more vague symptomatology. They still could have that pressure for sure, but there are some women who also have GI symptomatology, maybe breathing a little faster, and a rapid respiratory rate. The earlier that you become aware that something heart may be going on, The earlier you seek treatment, same thing with stroke, which I'll talk about in a minute, the better. Prognosis is much better for people who recognize that they could be having a heart attack and seek treatment right away. Heart disease kills more women than all cancers combined. In fact, breast cancer kills about 1 in 31 women, but heart disease kills 1 in 3. And we've really got to place more emphasis again on cardiovascular disease and ways to prevent it, because it still is our #1 killer. Stroke is the 5th leading cause of death in the United States. Some of you probably have heard me talk about being home alone with my mother when she sneezed, stroked out, and died right in front of me, which is why I am so passionate about wellness and prevention. My mom had a history of headaches for over a year. My dad kept saying, please go to the doctor, figure out what's wrong. Well, she went to her family doc just 1 week before she died, diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. She never took it. Yet 1 out of 2 people with high blood pressure don't have it under control. High blood pressure is a leading predictor of stroke, of heart attack, which is why we really encourage all our faculty and staff, please complete your PHA every year. Get a biometric screen. Know your numbers. And if your blood pressure is elevated, please take your medication and engage in healthy behaviors that I'll talk about in a little bit to really help your situation. The aging United States population is going to lead us to a 22% increase in strokes by 2030. High blood pressure and atherosclerosis, clogging of our arteries, are the most common treatable risk factors for stroke, cognitive decline, and dementia. And what a lot of people don't realize is silent or subclinical strokes occur in 6 to 28% of older adults, and they are associated with cognitive decline and dementia. White matter lesions in the brain can be seen in 40 to 80% of older adults, and they are associated with vascular risk factors, especially high blood pressure, and they increase the risk of cognitive decline and dementia. Nearly half of adults more than 65 years of age have cognitive deficits 6 months after an ischemic stroke. So, in terms of quick facts about stroke, every 40 seconds, somebody has a stroke in the United States, stroke death declines have stalled in 3 out of every 4 states. We are one of them in the state of Ohio. And just like other types of heart disease, up to 80% of strokes are totally preventable with just a few healthy lifestyle behaviors. Well, why has progress so slowed in preventing stroke deaths? Because, as I mentioned, a lot of people with high blood pressure still don't have it under control. And we've also seen an increase in chronic diseases that are risk factors then for stroke, like diabetes and obesity. Major stroke risk factors include high blood pressure again. So please, everybody, get your blood pressure checked at the very least every single year, much more often if you have pre-hypertension or hypertension, diabetes, hyperlipidemia, atrial fibrillation is much more common as we get to be older adults. People with atrial fib are 5 times more at risk for stroke because in atrial fib, your heart quivers. And when it quivers, the chance of clotting is much greater. And a clot then could break off and migrate to the brain. Tobacco use is still the leading cause of preventable death in the United States. And then physical inactivity. So I like everybody to remember the acronym FAST for signs of stroke. The F stands for facial drooping on one side in particular, arm weakness. So if you have somebody hold their arms out in front of them like this and you push down on them, is one arm much weaker than the other. S is for slurring of speech, very common in stroke. And the T is so important. It is time to act. Never feel bad about calling 911 if you think somebody or yourself could be having a stroke. Because if we can get people to the emergency department within a 3-hour time period of them starting to have these symptoms, in a lot of cases, the clot busting drug to break up the clot can be used, but it's got to be used within approximately 3 hours after the onset of symptoms. So please, everybody, remember FAST. It could really be a tremendous lifesaver. Well, even though we spend more money on healthcare than any Western world country, we remain toward the bottom in health outcomes. One of the big reasons is our country only invests about 8% of our healthcare spending in wellness and prevention. We are always going to need a great system to manage chronic conditions. But we've got to take the time now for good self-care, because if we don't, that's going to be time we're going to have to take later for sickness. Overweight and obesity is soon going to surpass tobacco as the number one cause of preventable death and disease in the United States. 1 out of 2 people have a chronic condition right now. 1 out of 4 have multiple chronic conditions. And what's really sad is our children are now predicted to have a shorter lifespan than their parents. The first time ever in our history. That is why, again, healthy lifestyle behaviors, starting with our children, are so important. We're going to be sponsoring a step-a-thon in April, and to benefit the Ohio Child Wellness Fund. And I'm hoping you will sign up and join us for this particular step-a-thon, because all funds raised will go to support programming of children across the state of Ohio. So at Ohio State, our university-wide wonderful wellness team really is very focused on risk factors that can be changed to prevent cardiovascular disease. So high blood pressure, high cholesterol, overweight, obesity, diabetes, physical inactivity, unhealthy eating. And there is a big connection between stress, anxiety, depression, and cardiovascular disease. We are very focused, especially now during COVID, on improving the mental health and well-being of our faculty, staff, and students, because we know when we experience depression, stress, and anxiety, cortisol just floods into our body. Cortisol has so many negative effects on our cardiovascular system, but also other systems, including our immune system. So this is a nice checklist on how to preserve your brain health. It's a checklist for stroke prevention and goes through the main elements of preventing stroke, such as manage your blood pressure and cholesterol, know your blood sugar, don't smoke, get active, get moving. Even 11 minutes a day has good cardiovascular benefit. Limit alcohol. This recommendation has recently changed. It used to be 1 drink a day if you're a woman, if you drink, and 2 a day if you're a man. The latest recommendation now, I'm sorry guys, is 1 drink a day if you do drink. Reduce your stress and act fast. So this is the website for this wonderful American Stroke Association Prevention Toolkit. And I would encourage you to download it, read it, and share it, because it has a lot of fabulous evidence-based strategies to prevent stroke. Brain health, again, heart health is correlated with brain health. So the actions that you take today are not only impacting cardiovascular health, but they're also impacting your brain's health. So everything we always talk about, eating healthy, exercising 150 minutes a week, getting at least 7 hours of sleep a night, getting regular checkups, not smoking, limiting alcohol use, also very important for heart as well as brain health. So you heard me say, technically, cardiovascular disease is still our number one killer. But if we take into consideration all causes of death and disease in the United States, it's our behaviors. And that's really great news in some ways, because behaviors are under our control. The not so great news is behaviors are very difficult to change in ourselves. Most people, sadly, don't change unless crisis happens or their emotions are raised. And then beware the chair. I so wish I could give all these facts to everybody and suddenly they would behave differently. But that's not how it works. So we're always trying to motivate everybody because, again, if everybody at our university could do just a few simple behaviors, we could so cut down on chronic disease. People would have a better quality of life. I stand for 80 to 90% of my day. And if you're sitting now, I'd really encourage you to stand for the rest of my presentation. Well, I have terrible cardiovascular genes. You heard my mom had a stroke and died when I was 15. My dad had a major heart attack when I was 19. I could get up in the morning and say, I have bad genes. I'm going to die young anyway. So I might as well eat whatever I want to eat, not exercise, because I'm going to die young. But research shows us more than our genes, our social circumstances, the healthcare that we get. It's really our behaviors that are the greatest contributor to whether we're going to die prematurely or not. Many of you have heard me share this over and over again, but I need to keep beating the drum in hopes that we're all going to get here one day. And that is exercising 30 minutes, 5 days a week. You know, people say you're pie in the sky, Bern. I can never get to that point. And I say, sure you can. Cut at least 3 Zoom meetings that are 60 minutes down to 50 minutes. So you have 10 minutes for walking up and down stairs, doing some jumping jacks, putting on your favorite music and dancing. Just move more and sit less. Healthy eating, 5 fruits and veggies a day. I start my days, the majority of my days, with a smoothie. I put some spinach, an avocado, a banana, raspberries, blueberries, or strawberries. In my NutriBullet, I add flaxseed, a little bit of turmeric, and bam, I get 5 in first thing in the morning. Don't smoke. And again, if you don't drink alcohol, don't start. But if you do, 1 drink a day. Getting 7 hours of sleep on top of that, the magic is 7. If you get less than that, again, cortisol's kicking in like crazy. And engaging in stress reduction practices on a daily basis, whether it's cognitive behavior skills building or mindfulness, doing things that we know are evidence-based that work. If we all just did these things, we would see so much less chronic disease. Only 20 minutes of physical activity can improve brain circulation and functioning. These are PET scans, and you see what the brain looks like after sitting quietly versus taking a 20-minute walk. When you take that walk, look at the red in the brain. Those are neurons that are firing. So if you have, again, those mid-morning and mid-afternoon slumps, what you need to do is get up, get moving, walk, do jumping jacks, just do something to get more active. So I want to now go over some tips for lowering blood pressure. Very importantly, as I talked, we got to get it checked regularly. If it's hot or you're pre-hypertensive, you got to monitor it more frequently. And if you've been prescribed medication, please take it consistently, regularly. You would be amazed. Even a 6-pound weight loss does magic for helping to lower blood pressure as well as unhealthy lipids in our bloodstream. Stop smoking if you smoke. And that's not easy, but we have wonderful resources here at the university to help you. Engage in regular physical activity. Limit your salt intake, less than 1,500 milligrams daily. Don't add salt to your food. And if you're a person who likes to do that, put the salt away so you can't see it. You'll be less likely to add it if it's not available. And then we've got to do all we can to regulate our stress and our negative emotions. Cholesterol has a positive function. It aids in tissue and hormone formation, and it protects our nerves. The ideal is to keep our total cholesterol lower than 200, but certainly less than 240. LDLs, I've nicknamed them lousy lipids. Those are the lipids that tend to cause real issue in our bloodstream. They tend to break off easier, they clot easier, but HDLs, or high density lipoproteins, or I call them happy lipids, we want more of those. They're the good high-density lipids that help to swipe the low-density lipids out of our bloodstream. Our triglycerides should be less than 150. Our non-HDLs less than 130. And you can figure out your total cholesterol happy lipid ratio by dividing your total cholesterol by your high density lipoproteins. So for instance, if you have a total cholesterol of 240, but you have high density lipids of 60, 240 divided by 60 will give you a ratio of 4:1, which is still acceptable. So tips for raising your happy high density lipids: quit smoking. Even again, a small weight loss can really help. Engage in physical activity. 150 minutes of moderate intensity activity a week. Eat healthy fats like olive oil particularly if it's cold, flat pressed, can really help to raise HDLs. And again, limit alcohol intake. Tips for lowering your lousy lipids include: make sure you know your numbers, eat plenty of fruits and veggies, whole grains and beans, limit foods high in cholesterol, like red meats, cheeses, whole milk, lard. Bake, broil, or roast your food rather than fry. Get your physical activity in. Eat a handful of nuts daily. The best type of nuts to eat: almonds and walnuts. And again, use olive oil for cooking and avoid trans fats. So make sure you're reading your food labels. Plant sterols, more research is coming out on them, that they have been finding they lower LDL cholesterol. Those are found in some margarine spreads like Bechamel. In terms of stress and depression, before the pandemic, about 1 in 5 children, teens, and adults have a mental health problem. Yet only about 25 to 30 to at greatest 50% of people get help. If you're experiencing stress, anxiety, and depression to the point where it's interfering with your judgment, your concentration, your functioning, please get help. It's a strength, not a weakness, to recognize when we're under stress or we're depressed and to get help. Again, at the university, we have so many fabulous resources, including 5 free sessions at EAP if you want and need to talk to a counselor. Well, this time of year, especially in Columbus, a lot of people experience the blues or seasonal affective disorder. And the difference between true major depressive disorder and the blues is depression does interfere with functioning. With the blues, you might feel sad or down, especially when the clouds are out for days, but the feelings pass in a few days and they don't interfere with functioning. Chronic stress leads to the release of these hormones such as cortisol and adrenaline. They persistently stay elevated if you're under chronic stress, and they can lead to serious health problems like heart disease and high blood pressure. Well, I'm excited to tell you that this past month, we received designation from the Centers for Disease Control as a Million Hearts University and health system, the fourth only in the country, because of all we do to improve our population's cardiovascular health. We were the first university to be named a partner of the CDC's Million Hearts Initiative. Remember your ABCs. Appropriate aspirin therapy. Talk to your physician or your nurse practitioner who provides primary care for you, whether you should and you meet the criteria to be on a small dose of aspirin daily. Control your blood pressure, manage your cholesterol, stop smoking if you do smoke. And at Ohio State, we added a second S to the ABCs, and that is stress reduction. And we've got so many programs available to help you do that. The key, take time to engage, participate in all of the wonderful programs we have available for you at the university. But very importantly, please take time, just a little time every day to take good self-care. Learn cognitive behavioral skills, which are such an evidence-based, gold standard treatment for stress, anxiety, and depression. In CBT and CBT skills building, we teach everybody how you think directly impacts how you feel and how you behave. Because by the time we're adults, we have formed a lot of what we call negative cognitive patterns, distortions, like I should be a better parent. I should be a better teacher. So I ask you again to catch, check, and change your automatic negative thoughts for the next 30 days. When you notice your mood has changed or intensified, you're angry, you're feeling stressed, you're depressed, ask yourself, what was just going through my mind? Is it helpful? Is it true? Do I have the evidence to back it up? 98% of the time, the answer is going to be no when you check your thoughts. So change, turn them around deliberately to a more positive framework so you feel emotionally better. We've got to program our brains every day with positive thoughts. Our brains are like a computer. What we put in will come out. If we're exposing ourselves to too much negative, say media, during the day, we're going to feel stressed, depressed, or anxious. So start every morning with 5 minutes in a positive thinking book, whatever book you think will help. If you say, I have no time, put the book by your toilet. So when you sit down in the morning to go to the bathroom, you pick up a book, you start reading, good stuff going in, bad stuff coming out, but you get a positive boost for the day. I have been doing that for the last 30 years of my life, and I can't tell you how this one habit can really help. We have more research coming out too. Positive self-affirmations can really help with our positive thinking. Pick one. Every time you put on your mask, pick one. Every time you wake up, say it out loud 10 times. Saying it out loud truly begins to change things within the brain and helps us to be more positive. If we could teach our children and ourselves to get up every morning and do what this little girl does, you'd be amazed at how much that improves our mood and decreases our stress.
Now my whole house is great. I can do anything good. I like my school. I like anything. I like my dad. I like my cousins. I like my aunts. I like my Allisons. I like my mom. I like my sisters. I like my dad. I like my hair. I like my haircuts. I like my pajamas. I like my stuff. I like my rooms. I like my whole house. My whole house is great. I can do anything good. Yeah.
I love that. The other simple evidence-based technique that has so much research behind it is to take a dose of vitamin G every day. If everybody would just put in the chat right now, somebody or something you're grateful for today. If we got up every morning and did that, and before we went to bed at night, again, our mood would improve, our heart health would improve, our sleep would improve, and our blood pressure would improve. Try it. Try it with your family. Make a gratitude board in your house. So when everybody gets up in the morning, that's what they write, the one person or thing they're grateful for. Other strategies for preventing and dealing with stress, anxiety, and depression. Break your routine if you're rutted. It could be something as simple as driving a different direction to work when we start getting back to work on a more regular basis. Manage your energy. I always thought I needed more time in my day. And then I went to corporate athlete, and I really learned I don't need more time. I need more energy with the time that I have. We run Health Athlete virtually now. It's 7 1-hour sessions. If you're interested in taking that course, which is so wonderful, please reach out to Dr. Brenda Buffington, one of my great wellness team members who directs that program. We've put about 2,000 faculty, staff, and students through that program with really good feedback and outcomes. Practice guided imagery. There's a lot of YouTube programs for free that can help you learn how to practice imagery. Check your vitamin D level if you don't know what it is. During the winter especially, It can drop because we're not getting exposure to the sun as much as during the other months. And low levels of vitamin D can contribute to depression and overweight and obesity. Have an attitude of gratitude. Take that vitamin G every day. When we get stressed, take just 5 deep abdominal breaths using the 5-7-8 method. Breathe in, count to 5, hold it for a count of 7, and breathe out slowly for a count of 8. Talk to somebody you trust if you're feeling stressed, anxious, or depressed. Know your limits. Don't feel guilty about saying no. One of the contributors to too much stress is we take on way too much, and then we'll do what we have to do to follow through, but we pay a price. So we got to know how to comfortably get better at saying no. If somebody asks you to do something and your immediate response is, oh, gee, I really can't do it, at least say to the person, I need a little time to think about whether or not I really can take this on. And then stay aligned with your dreams and your passions. When we're aligned with our dreams, our purpose, our passion, we have so much energy. I'm so blessed because I don't feel like I work. If we're engaged in doing what we love, what we're passionate about, we have so much more energy and we don't feel like we're working. Seek help, please. If you're experiencing stress, anxiety, and depression for more than 2 weeks, and it's interfering with your functioning, it's a strength, again, to admit we're struggling and to get help. Join us for the Be Kind, Mask On, Mood Up movement. So every time you put on your mask from now on, I'm asking everybody to do 3 evidence-based tactics, 3 abdominal deep breaths using the 5-7-8 method. Be kind to yourself. Say a positive self-affirmation 10 times. Be kind to others. Take that dose of vitamin G every day. Turn around and tell somebody why you appreciate them. If we all do these 3 evidence-based tactics, when we put on our masks from now on, we will really reduce our stress and improve our mood. The blue zones of happiness are spots throughout the world where people are happy, the happiest in the world. And what these psychologists found that was special about these places is the people had purpose, passion, and pride. Just knowing your sense of purpose is worth 7 years of extra life expectancy. So I want you to answer this question. If I were your fairy godmother today and give you any dream or wish you could achieve in the next 5, 7, 10 years, what would you do if you know you cannot fail? If you're aligned with that dream that pops into your mind. Again, you're going to get up on Monday morning and say, I'm so excited I get to go to work today. Purpose, passion, and pride. Well, we're never too old or mature to pursue our dreams and our passions. This is a 105-year-old man who got his diploma years, decades later. So let us never use age as we can't pursue our dreams. I'm going to finish with a story about Lou that I hope will inspire you. When I was research dean at the University of Rochester years ago, an 88-year-old man, Lou, walked into my office. I said, nice to meet you, Lou. Why are you here to see me? He said, Vern, I've read all about you on your website, and I know now how important evidence is to get things to stick. I was home alone choking about 7 months ago. I inhaled a hardtack candy, and I really thought I was going to die. And as I was starting to black out, I gave one more attempt to do a Heimlich maneuver by pushing myself against a chair right below my sternum. And that hard candy popped out. But he said, I got an idea then for a device that if I could create a device that could perform a Heimlich maneuver if I'm by myself, wouldn't that be a lifesaver? So he reached into his briefcase and he pulled out a very rudimentary form of this device. This was a broom handle that he cut. He had 2 paper towel rolls masking taped to the broom handle as the handles. And then he had a styrofoam block taped to the bottom of the broom handle. So he said, what you do if you're choking, you put this below your sternum, you push up like a Heimlich maneuver. I said, Lou, I could see where this could work, but why are you here to see me? He said, Vern, I need you to get me the evidence behind this device. Wow, what a character builder. I pulled a team together and we started to formulate a clinical trial and a device to check this against choking Charlie and the Heimlich maneuver. That's what we used to teach. Well, in the interim, I was recruited away to Arizona, and I left my team to finish this trial. Kind of forgot about Lou and his device. 4 years later, my assistant walked in my office and said, Vern, there's a fella named Lou from Rochester, New York on the phone for you. I ran to the phone. I was so excited. I'm like, Lou, is this you? You're still alive. He said, Vern, not only am I still alive at 92 years of age, but I've got a patent now for Save a Life. I have a manufacturer in China that's going to mass produce it. Vern, your team at Rochester never finished the trial. I need you to get me the evidence now. At 92 years of age, I flew Lou out to Arizona, and I will tell you that man had a twinkle in his eye and a fire in his belly, so much greater than so many 20, 30, 40, 50, 60-year-old people, because he had a dream and he had a purpose and a passion. Well, I was telling this story to a group of my alums, and there were two women in the back of the room crying. And I went up to them after my talk and I said, could you share with me why you're crying? And one of the women said, Bern, we had a fabulous dream to create a healthcare business about 15 years ago. We put together a business plan. We started to work on some investors, but everybody around us told us it wouldn't work. It would never come to fruition. So we gave up on our dream. And we're sitting here 15 years later with so many regrets. And I said to the two women, would you share with me how old you are? One said 70, the other said 71. I said, look at Lou. You have the rest of your life. Put a dream back on the stove again and get cooking. Well, Lou saved a life. He died prior to seeing it come to fruition. This device had been marketed on Amazon for quite some time. I went to check if it still exists, and I can't find it. But I'm here today to tell you, you want to improve your heart health, you want to improve your brain health, get moving, get those healthy behaviors going, and get a dream and a purpose and a passion, if you don't have one, back in your life. And you will do wonders to prevent cardiovascular disease and preserve your brain health. I didn't have a mom to see me graduate from high school, college, go on to have my beautiful family. They are my motivators when I don't feel like exercising. They're my motivators when I don't feel like healthy eating, because they want me to be around for some time to come. Who are going to be your motivators? Please don't walk away from this talk today without setting a 30-day SMART goal that you commit to. Today can be your January 1. It was great to be with you today. I have a few minutes, Josh, if you have any questions.
Hi, Bern. Josh actually had to head out for another meeting, so I'm going to take over and do the Q&A with you. We do have a couple of questions. The first is, what do you say to people who have tried everything to lose weight but simply cannot because their body is meant to be a certain weight? Someone who does all the things right, sleeps well, drinks, eats balanced diet, gets active, but the number doesn't budge. I feel like the focus shouldn't be on weight, but instead the healthy behaviors.
I couldn't agree with you more. Some people's body composition just is what it is. I always focus the most on the healthy behaviors. If you're engaged in those healthy behaviors, that's going to go a long way toward cardiovascular health, brain health, immune health. So keep up those healthy behaviors.
If anyone else has any questions, please feel free to throw them in the Q&A. We have one more, but it's a comment. Someone wanted to let you know that every presentation of yours that she has attended has been very inspiring. And she wanted to let you know that she's off for a long walk and her brain thanks you. So anyway, if anyone else has some questions or would like to chat with Bern, we've got a couple coming in. Are there any resources on campus for hormone treatment and balance that you know of?
For what, David? I didn't pick that up.
Hormone treatment and balance.
I'm sure there is. Reach out to me personally at melnick.15 with that question, and I'll do some investigative work and get back to you with who you can contact.
How do you find a dream, drive, or a job that doesn't feel like work? What resources are there?
Yeah. Again, I think for you to really reflect on that question, I ask that question off of every candidate that I interview. And I'm really surprised, but very few people can identify that dream right off the bat, which is why I ask that question all the time. Spend some time reflecting on that question. You know, if everything would go your way in the next 10 years, what will you do if you know you can't fail? That question is so key. Once you identify and get clear of that question, you're going to be able to see how you got to align a role or position to that dream and purpose that you have. It's like finding your North Star. I got to run to my next event, but if anybody has any further questions, don't hesitate to reach out to me at melnick.15, and please engage in all the wonderful programming that we have available at our university. Go Buckeyes and stay well.